Hi everyone, my name is Yazid. I'm from Universiti Teknologi, Faculty of Pharmacy. Today I will be presenting my paper on precision chemotherapy with functionalized chitosan nanoparticles. My co-author is Professor Wong Tin Wee, also from the Faculty of Pharmacy. So just as an introduction, cancers remain a global health concern and surgery is a first-line treatment option but is often not possible due to advanced cancer stage. And so chemotherapy is a standard treatment option for unresectable cancers as they are highly efficacious and demonstrate anti-metastatic effects. Examples of commonly used chemotherapy agents include alkylating agents, ribonucleotide reductase inhibitors, topoisomerase and hypoxia-inducible factor 1 alpha inhibitors, and antimicrotubules, among others. However, there are significant challenges of chemotherapy in the clinic. The most common being the use of highly toxic drugs, which are highly cytotoxic for the purpose of killing cancer cells, and also the poor specificity due to poor cancer targeting causing systemic toxicities, which is a common side effect seen in chemotherapy in cancer. And also finally due is the occurrence of drug resistance, which results in a significant or relapse in cancer. And so chitosan nanoparticles for chemotherapy is the main subject of my presentation today. And according to the US FDA, the definition of nanomedicine is particles or drug particles that are sized between 1 nanometer to 1000 nanometer. And so chitosan is a naturally derived biopolymer from chitin, and it is a polysaccharide and is therefore highly biocompatible. Being a polysaccharide itself means it's non-toxic to the human body. And also chitosan has various anti-cancer properties as shown in this figure here, which includes increased membrane permeability, selective cancer cell cytotoxicity, immune cell activation and modulation, and also chitosan has also been shown to possess antioxidant and anti-inflammatory properties. And so this means chitosan is also a highly flexible polymer, and which allow us to design various nanoparticles with various functions, and which can also be able to load various chemotherapeutic drugs. And so chitosan in the form of nanoparticles come in, for example, in dendrimers, nanoemulsions, hybrid nanoparticles, polymeric nanoparticles, nanomicelles, liposomes, and also transposomes. And chitosan nanoparticles can be functionalized for targeted chemotherapy. And so recent approaches to target drugs for chemotherapy to functionalize chitosan includes passive and active targeting. And so for passive targeting, there are several approaches whereby chitosan can be functionalized. So passive targeting for drug delivery in cancer involves passive accumulation of chemotherapeutic drugs at the cancer tissue. So this means there is no active targeting involved in this drug delivery vehicle, and so the nanoparticles containing the drugs will accumulate at the cancer tissue passively, and this is mainly due to the enhanced permeation and retention effect, or the EPR effect. So what this involves is the nanoparticles will accumulate at the cancer site passively due to an increase in retention time or an increase in circulation time, which results in the nanoparticles being retained at the cancer site. So examples of chitosan functionalization to improve passive targeting includes chitosan complex itself, hydrophobically modified chitosan, chitosan anionic polymer complexes, phosphorylated chitosan, thiolated glycol chitosan, carboxymethyl chitosan. And so these functionalizations have been shown to improve drug encapsulation and also provide control release in vivo. And other forms of functionalization to improve passive targeting includes efforts to increase or prevent chitosan early clearance from the systemic circulation. So this can be chitosan lipid hybrid formulations or also stealth coated chitosan. So this would improve the retention time of chitosan in vivo and also result in an increased accumulation of chitosan along with its drug load at the cancer site. However, more recent studies have shown that chitosan can also be functionalized to promote active targeting. So what does active targeting means? Active targeting means the functionalized nanoparticles actively seek for the cancer cells or actively try to overcome the barriers to reach the cancer cell to be able to deliver the chemotherapeutic drug successfully. And so there are several methods whereby chitosan can be functionalized for active targeting. And this mainly involves the use of ligand-mediated cancer cell receptor targeting. And because of this highly targeted drug delivery, it offers a high specificity in terms of targeting the cancer cells. So that means the chitosan nanoparticles are highly specific. So there is a less chance of the chitosan nanoparticles to deliver the drugs in normal living tissue. So this has several advantages. First of all, it allows the use of a lower drug dose because you are not delivering the drug in a systemic manner. So there's no need for a high dose of chemotherapy drugs. And also, the other advantage of targeted chemotherapy is, of course, the reduce of adverse effects because less normal tissue is being damaged or being killed by the chemotherapeutic drugs. However, the process of active targeting in cancer drug delivery requires stable and highly specific targeting ligands. So not all ligands are able to be used as targeting ligands for active cancer targeting in chitosan nanoparticle functionalization. The examples of active targeting ligands that have been used in recent studies to functionalize chitosan nanoparticles for active cancer targeting include aptamers, ligands like hyaluronic acid, mannose, folate, and biotin, and also several peptide chains and hormones. For example, the K237 peptide is a very well-known peptide that can target the VEGFR2 receptor, and the T7 peptide, which is a transferrin peptide, which is capable of targeting the transferrin receptor, and also the RGD peptide, which is capable of targeting the alpha 2 beta 3 integrin receptor. So these are the several peptide sequences that have been that are common in the studies that promote active targeting of cancer tissue and cancer cells. And we also have the well-recognized monoclonal antibodies, for example, cetuximab, trastuzumab, and also anti-HMAM. So these are the three examples of monoclonal antibodies that have been used to functionalize chitosan in order to promote a significant degree of active targeting to allow a specific drug delivery to cancer cells. So, in a nutshell, nanoparticles can address the issues with conventional chemotherapy and help cure cancer. However, favorable nanoparticle physicochemical properties are needed to target cancer cells. So, based on the recent body of research, the favorable properties include cationic surface charge, a spherical morphology, hydrophobic nature, and monodispersed particles. So these properties are designed into the nanoparticles in order for nanoparticles to have a degree of affinity towards cancer cells as compared to normal cells. And so chitosan nanoparticles are promising as a natural biopolymer cancer nanomedicine. However, given the advantages of both passive and active targeting systems to deliver chemotherapy specifically at cancer sites and overcoming the barriers of specific or drug targeting, the ideal system for targeted cancer drug delivery should combine both passive and active targeting designs. So this means maybe the design of a nanoparticle can incorporate passive targeting as an initial step. For example, nanoparticles that have a higher retention time nanoparticles that resist systemic clearance from drugs from the blood circulation, would to improve the enhanced permeation and retention effect and increase its accumulation at the cancer site. However, to synergize the anti-cancer effect and to give it more specificity in terms of drug targeting, active ligand-mediated cancer targeting is always the go-to mode of delivering chemotherapy specifically to cancer sites. And so these are the list of references for my presentation slides, and thank you so much for listening, and I hope you enjoyed the presentation.